Hi, good afternoon, everyone, and welcome to the second in our series of Academy launch webinars, Finding the Leader Within. My name's Laura Hyland, and I'm the head of the Learning Academy here at Education for Health, and I'm delighted to be hosting the series of webinars this week to showcase some of the exciting new courses that we've been developing as part of the Academy offer. Just a couple of housekeeping bits before we start. This session is being recorded, so you will be able to access that later on, and it will also be available for anybody who's not been able to make it today. You're encouraged to use the Q&A function if you want to ask questions or participate at any point. If you have a look at the top of your screen, you should see two speech bubbles, one with a question mark in, and you can type your comments or questions into the chat as we go along. I'm joined by my colleague Sarah from our marketing team this afternoon, so she'll be helping me to pick up any questions or comments that come through on our socials, and we'll have time for general questions at the end of the session. I'll also be sharing a very brief evaluation form at the end of the webinar so that you can send us your details if you'd like to hear any more about our leadership courses or any of the other courses that we offer at Education for Health. So without any more ado from me, I'm going to hand over to our presenters today. I'm really pleased to introduce Dr. Linda Edwards and Simon Phillips. Simon, I believe you're starting us off today.
I am. Thank you, Laura. Welcome, everyone. This is a really exciting venture. We the first opportunity that Linda and I have had to co-present something. So this is really exciting. There's going to be a quick run through of some things that I hope, well, we both hope actually, will really help you right now, because it's an incredibly challenging time to be a leader in health and care. For so many reasons, not just the pandemic, but everything else that's going on in society right now. It's a really challenging time. So hopefully you'll go away today with some really tangible things that you can use in your life. So Laura, if you pop the next slide and I'll quickly run through the agenda, and then we'll Linda and I will formally introduce ourselves. So today we're going to have a look at the DNA of a leader in health and care. What is it that fundamentally distinguishes, if you like, a leader in this sector? We'll talk about how to build confidence, which actually underpins everything else. If you feel confident, then actually you'll act and you'll interact with other people in a way that's really coherent, and they'll understand it and they'll get excited about the work that you're talking about doing together. So building confidence is a great first step. And then we'll look at something called choosing your identity, because quite often we identify with so many different things that have nothing to do with who we are. So we'll explore that one together. And then we're going to talk to you about a program that we've got coming up in the new year, which is based on this launch pad today, but it'll help you with building resilience, building effectiveness, building a powerful dialogue so that you can, as a leader, engage the people around you. And all of that will enable you to create a personal leadership approach. So that's what we're all about today. In the next, I think we've got about 6 hours, haven't we, Laura? No, we're just here for the next hour. So strap yourselves in. Contribute as much as you can in the chat. Let us know what you're thinking as we go, and we'll do everything we can to answer your questions as we go. So, Laura, next slide, please. Linda, ladies first. You go. Do you want to introduce yourself?
Okay, thank you. I'm Dr. Linda Edwards. I'm the Chief Exec of Education for Health. I've actually been the Chief Executive here for 4 years now. I'm really passionate about improving health outcomes, and I believe that there are opportunities for many of us in the health system, whether we're leading a small team, whether we're leading an organisation, or basically whether we're leading ourselves. So it's a real pleasure today to be sharing some of our thoughts and experiences with you so that you've got some practical skills to be able to take away.
Brilliant. Thank you, Linda. And I'm Simon Phillips. So I founded the Changemaker Group. We've been working across health and care for more years now than we care to remember. But basically, we care about our NHS, and that's why we spend so much time in this space. And my job, if you like, is to just get out there and create as many change makers as we possibly can and support them in their leadership ventures. So I've written a few books and done loads of training over the years, and I'm currently setting up Leading the Field, which is an online sort of continuous personal development platform for health and care professionals. So this is an exciting time for all of us at the moment. There's so many opportunities to come together online and learn together, and it means that we can actually discover new relationships that we wouldn't have otherwise found in the physical world, if you like. So this is a great time, as well as all of those challenges that we were talking about at the start. So to kick us off, I believe Linda's going to take us through a little bit of a talk on this point about confidence.
Thank you. Next slide, please, Laura. So whilst Laura's putting the slide up, the key thing for us around this particular programme and what sets it apart is that it's all about you. A lot of the courses we go on and hear about, and in fact many of the ones we do, are around skills and particular knowledge. It's rare that we get a time to think about ourselves, particularly at this point in time when the NHS is under such strain, when we're all trying to juggle balls of parenthood and elderly parents and running homes and running a really busy job. There's very little time for you to think about you. And actually, if you don't think about you, who is going to think about you? And if you spend all of your time thinking about everybody else, where is you in all of this? Where do you get your energy from to be able to carry on doing the things that you love and want to do in your life? Next slide, please, Laura. So the big question is, which one of these is you? Now, it may be that you are the little pussycat some of the time. It may be that you're the great big ferocious lion some of the time, or it may be that you're somewhere in between. But most of the time it's about, where do we place our identity? Do we want to stand up and be the lion, or do we want to actually be the kitten or the little pussycat? It's our choice. And when we make those choices, and we could be different things every day. I mean, you may be the lion at home and the kitten at work, or you may be the kitten at home and the lion at work. It's all part of the rich tapestry of who you are and what you bring to the table at any given point in time. Next slide. And the key component of who we are, one of the biggest telling points, is how we communicate. Communication takes place on many, many different levels. And here I've got a very simple example of the different levels of communication. So just a question for you to think about for a moment. If that circle represents the whole of our communication, what do you think the component parts stand for? And those of you who've seen this before, Sarah, are not allowed to give away the answers. It may be surprising to some of you. Anybody who's been on a basic psychology course may have got the answer to this, but the key thing is that we need to remember how we communicate gives off energy and tells people who we are. So the first part, Laura, are the words. Now that is only 7% of how we communicate. Think about how much effort we put into thinking about the words that we use, the words that we write down in documents. We spend enormous amounts of time, probably in excess of 90% of our time, thinking about the words that we use, and yet they're only 7% of the way that we communicate. So think about what that actually means. What would happen if you sat in a room with someone and didn't use words? Do you think they'd still get a feeling of who you are and what your intention was? If you haven't tried it already, I suggest you try that. It can be quite amusing, but it also can give you some amazing feedback on the kind of messages you're giving out when you're just sitting there. So the next section is about how we use our bodies. It's our physiology. So 55% of the way we communicate is how we use our body. So if you thought really carefully about the words that you use, and you want to put a really strong message across to a group of people, but you sit there all kind of hunched up and giving your message with as much power as you can, what do you think actually happens? The message that people receive is all about how you're sitting, how you're breathing, how confident, we're talking about confidence here, how confident your messages are. So it's really worth considering. And finally, the third component is how we use our voice. So that's the speed and the pace and the tone and the volume and all of those things. So if you think about the fact I'm sitting here talking to you right now, I'm using my body and I'm using my voice in a particular way. You may or may not be paying attention to the words that I'm using, but actually that won't really matter because you'll get the message. Now, I know that feels like, what the hell is this mad woman talking about? You try it sometime. It is absolutely amazing that people will really focus on you, your voice and your body, and very little on your words. Next slide, please. So where does confidence actually come from? Next bit. So it's our thoughts. And just think about this one. You have at least 60,000 thoughts in a day. 95% of those are the same as the ones you had yesterday. So if your thoughts are empowering and supportive, then you'll feel better. If your thoughts are negative and you keep building on those negatives, how do you feel? You actually feel negative. So where do you then get your confidence from? So your thoughts lead to a feeling that leads to a behavior. Those behaviors affect the outcomes of any given situation. And the outcome, because you've been thinking this thing is going to go really badly wrong, it does go really badly wrong. So that is reinforced. So your thinking is reinforced. Well, I knew that was going to go really badly wrong because look, it did, which leads to more of a negative feeling, which leads to a behavior that isn't actually the best that you can be. So confidence really comes from flipping that. I always say that today I will be the best I can be. Now, it isn't perfect, but if I can endeavour to be the best I can be and hold that thought throughout the day, that makes me feel better. I actually feel quite good because even if I didn't sleep particularly well last night, I've actually decided, the thought is I'm going to have a really good day today. So I feel better. I actually probably behave, well, I do behave in a more considered way with people, which leads to a better outcome than if I'd said, oh, I'm feeling grumpy today because I didn't actually have a good sleep. So I get a positive feedback, the outcome is positive, that reinforces the fact that I'm being the best I can be, therefore I'm having a good day, which leads to another feeling and another behaviour, and they compound and build on each other. So by about 9 o'clock in the morning, I can be feeling pretty damn good because I've had a couple of successes to start the day. So just think about that, and Simon will talk about this a little bit more later. The kinds of thoughts and the conversations we have with ourselves are what actually shape us. And that it's just so important that we recognise that. So of all of the list down there, what is the easiest thing to change? If you say, oh God, I can't possibly change my thoughts. What could you change? Think about the other slide. Is it your physiology? Is it your words? Or is it the way that you use your voice? Just think, if you're feeling grumpy right now, or you're not really engaged, or you're thinking about something else, just take a breath and change your physiology. If you change your breath, take a breath, change your physiology, sit upright, it already has an impact on the way that you think, because you're actually feeling better already. Just a few little things to try, whether you're in the bath or you're driving to work or whatever it is, just check what you're thinking and what that makes you feel. Next slide, please, Laura. So the way we build our confidence is to look back, look at what we've already achieved. And an answer that says, well, I haven't ever achieved anything in my life. Of course you have. You've got out of bed this morning. You've gone into the office. You've gone into the car. You've done something with your children. You actually did some gardening at the weekend. You ran a successful meeting. You've done lots of things that can contribute very positively to building your confidence. And you know, if you have one meeting or one situation that doesn't work, there's some learning to be got from that so that you can understand what it is that you need to do differently to build that confidence again. Think of what you're good at. We've all got talents, we've all got strengths. You know, what we often get taught at school is to focus on the things that you're not that good at and improve them. But actually, if we just flip that around and say, everybody's good at something, you build on what you're good at, your confidence naturally increases. And therefore, so do your strengths and talents, bizarrely, but true. Set yourself some goals, or maybe even just one goal, something that you're likely to succeed at, but that is a bit of a stretch for you. The numbers of people I've worked with over the years who set goals that are way, way out there somewhere and then get really disappointed when they don't achieve them. Start small and grow, because the more we grow, the more we achieve our goals, the more confident we become. You can talk yourself up, tell yourself what you're good at, remind yourself what you're good at. You don't have to tell everybody else what you're good at, because remember, the words are only 7%. But if you actually talk yourself up and actually act in that way, then your confidence increases and people believe in you more. Get a hobby. How many people say they don't have time for a hobby? Lots and lots of people. And you can just do something really simple that helps your mind switch off for a while, that you enjoy, and enjoyment brings with it an increase in confidence. And that ties into the next bit of taking time for yourself. I take time for myself at 5:30 every morning. It's my favourite time of the day. Even before I let the dog out, I get up and I go for a little walk. It doesn't matter how hot or cold or wet it is. I just have 15 or 20 minutes to myself, and it really helps me set up the day. I feel so much better. If I'm not able to do that, my days change. So I have to talk myself up on those days. And be more active. The more active we are, the better we feel. Activity releases endorphins in our brain, which makes us feel good. So even if you're not very athletic, even if it's just walking down to the shops or walking around the village, do something that helps you become more active, so that those endorphins that can actually bathe your cells and makes you feel better. So you see, building confidence is quite easy, really. Simon, over to you.
Thanks, Linda. I think there's something about confidence as well that's just deep rooted. So it's about listening to ourselves a little bit. Just listen to that voice as it's coming out. Catch yourself saying some of the things that are maybe undermining your sense of confidence, and then ask yourself a little question: is that really true? Because quite often when we ask ourselves that question, we realize, especially with some of the things that Linda was suggesting there, you know, when you look back at all the great things that we've achieved, it probably isn't true. It might be true sometimes, and there might be some learning in there, but most of the time, you and the people around you are doing the best they can with the resources that they have and the time they have. And so go easy on yourself. Don't be your worst critic. I've heard myself sometimes berating myself more than even my best friend would. So just think about that. Think about the voice in your head and ask yourself, is that really true? Because if it isn't, that's your opportunity to step in and say, no, I'm not listening to that today. Today, as Linda said, I'm going to have a great day. And so I think this whole thing about confidence is tiny, tiny steps. And I do a lot of work with people around this notion of goal setting. And as Linda said, quite often it's massive goals and it can seem overwhelming. So we break those down. The big thing that doesn't happen though, can you guess what it is? They just don't start. So it's like after Christmas, isn't it? You know, you get that, right, I'm gonna go on that diet just as soon as I've finished all the food in the cupboard that I bought in for Christmas, or I'm gonna give up alcohol just as soon as I've finished all that drink I bought in for New Year. You know, so people sort of delay getting started, and we build it up then into something that it isn't. Really, if you can break it down into the very tiniest step, then you can make a start. So what I'd like you to do now, just before we carry on, is just take a minute or two for yourself, just to think about what's a goal, maybe something you've been putting off for a while, and think about what could you do? What's the tiniest step that you could take in that area? Write that down and see if you can do that by the end of the day. So I'm going to give you 30 seconds, just have a quick think. What's that goal that you've maybe been putting off, or something you've been making out is much bigger than it potentially is? What is it, and what's the very smallest step you can take to get started?
While people are having a think, Simon, we've had a lovely comment in the Q&A from Jackie, who's really reinforced that active process of talking to yourself. She says, I take care of my words and self-talk and redirect them when they're not positive. I find this really helps. And that really speaks to me about catching yourself when you're not being kind to yourself.
Yeah, definitely. Thank you, Laura. And thank you, Jackie. So I think, as I say, look for the tiniest step and get started. That's you, because what happens when you get started is what you'll be given is some feedback, and that feedback is the thing that can keep you going. And quite often, you know, we're not sure what the outcome is going to be, and that sometimes stops us from getting started, doesn't it? But if you forget the overall outcome, just set your mind on, you know, generally I'd like to get this goal moving. Start, you'll get some feedback, and then you can adjust and keep going. So all of which is going to build your confidence, because we never get negative feedback. Actually, all we ever get are opportunities to learn how we can do something a little bit differently. Brilliant. Okay, Laura, can I have the next slide, please? I love this bit. So identity, who are you? Who thinks they've got an identity already? So if you're in the webinar live, plonk something in the chat just to tell us, how do you identify? What's the title or the name, if you like, that you give yourself? Who do you identify as? And if you're watching this later, just jot something down just so we can work with it over the next few minutes. So who are you? What's your identity? Okay, so hopefully you've come up with something. I'm glad you've written that down, because what we're going to do now is give you some typical factors that sit behind the identity that most people associate with. Laura, can I have the next slide, please? So hopefully you'll recognize all of these factors. So the top one there, job. Most people, if you say, so, hi, Sarah, how are you? Or Sarah, introduce yourself. People say, I'm Sarah and I'm a marketing expert, or I'm Linda and I'm chief exec of an amazing organization, or I'm Laura and basically I'm the boss. You know, so people have all these job titles and they introduce themselves as that. So if that's you, that's great. There's no problem with that. It's just recognizing that that's how you identify yourself. But my question for you now is that all you've got? Is that really all you are? Because most people are only in work for about 8 hours a day, and most people, especially if they're my friends, only work about 2 hours a day as well. So, but they still identify with that job title. So have a think about that. Are you just your job title? Or is there more to you? Maybe you identify strongly around your gender. So I was interviewing somebody recently who is a campaigner in the transgender environment, and so they introduce themselves in that way. But are you somebody who identifies in that strong way and and you lead with that? But again, is it the whole story? Some people, especially those who are really proud or they've done a lot of education, introduce themselves with their qualifications and the various letters that they have after their name or before their name. So qualifications again can be a strong identifier. Race, there's a lot of broadening understanding of all these issues right now in society. So there are some people who identify themselves strongly with their race. Or family, I'm the husband of, I'm the son of, or I'm the father of. Those might be the things that I might say. How about you? Do you identify yourself as a specific family member? Such that the picture that people are building up of you, if you like, is strongly identified with that part of you. Or do you identify yourself by your contribution? I'm a campaigner, or I'm somebody who does a lot of work for charity, or I love getting out there and supporting my local team. I'm an Arsenal supporter if you're a lunatic like me. It's just like, it's those sorts of things. What's our contribution? Where do we like to identify ourselves? Some great ideas coming in the chat there as well. Somebody saying, I am myself. Fantastic, Charles. Because I think there is, when we think about who we are ourselves. And it is a mixture of all these things. But how do we introduce ourselves usually? And how do we potentially limit ourselves with a factor? Rather than saying, as Charles said, I'm myself, which is the whole picture, and then potentially breaking it down into a few things. A lot of people just lead with one and they strongly identify with that. So last year I was doing some work with some people who are carers. They care for various members of their families. And some people were saying things like, well, I'm just a carer. And my own mum cared for my dad for a few years. And when that went away, when my dad sadly passed, Mum's identity shifted. And I'm going to talk to you more about that in a moment. Okay, so what else we've got there? We've got a jolly supporter. I'm a mum of two. There you go. So, and it's interesting, is that never anything about me as a person. And actually, why not? Back to Linda's, ideas around building confidence. What else? So that's a great question to ask yourself in any situation. When you find yourself answering in the routine way, I'm a mother of two, then just ask yourself, what else could I say here? And just try one extra thing, because that will actually start to redefine who you feel you are and increase your confidence level straight away. Okay, next slide, please, Laura. So this is where we start to see the potential problem of strongly identifying maybe with only one thing. So for example, let's say I've been a doctor for 40 years and I always introduce myself as I'm a doctor. And then for whatever reason, I lose my job. It might be a personal injury, it might be, could be absolutely anything that means that I've lost my job. If you've ever been around someone who's lost their job after years of identifying as someone who has that role in an organization, you will know how much they struggle with moving beyond that. And that they go into a certain level of depression around that issue because they've lost their identity, or they feel like they've lost their identity. Of course, they haven't, but that's how they feel. And we know where the feelings go. The feelings start to come out in our behaviors. So think about some of the behaviors of somebody who's really feeling like they've lost their identity. That's what happens if somebody strongly identifies to just one aspect of their identity. And so what we need to do is keep building up all of them. So let's have a look at the the limiting context, back to that carer I was talking about, introducing herself, I'm just a carer. When we did this exercise and we started building it up, she had a list as long as your arm of different things that she had done, different things that she enjoys doing, different things that she's related to in terms of activities. And all of a sudden, in terms of who she was, her personal identity had become this instead of I'm just a carer. And even that we all tackled, because what is a carer? A carer is somebody who is looking after somebody who needs their support. Imagine all the skills and behavior and characteristics you need to be able to do a job like that. I mean, I think we came up with a list of 6 or 7 core skills that she was deploying to be just a carer. And so by the end of that conversation, she said, I'm a professional carer, which in her mind raised her up 6 levels and actually give her a whole load of things that she could add into that conversation. So be careful that you're not limiting your context when you say, I am just. And we quite often see this in hierarchical organizations. And so especially around health and care, we're very hierarchical, aren't we, in this industry? So you've got in the hospitals, you've got your consultants right at the top, and at the bottom of the organizational ladder are maybe some administration roles or some hygiene roles. But absolutely every single person in that organization is driving the health of the patients that come into that hospital and is looking after that person, whether they're looking after the hygiene of the environment or organising the specific healthcare program for those individuals. So everybody's got a critical role to play. None of us are just anything. All of us are a whole load of things, as Charles was saying earlier. So on to retired. How many people do we know almost like put off retirement because they fear I'm going to have nothing to do? You know, they've lost their identity. They were a role. They were someone who was building a career. They were somebody who was perceived to be of value. And people are forgetting when they retire that they're still of value. So it's a case of, okay, we may define ourselves in a specific way, but if we now define ourselves as retired, what comes with that? What opportunities does that create for that individual? And so it's just remembering, again, in this context, identity can actually undermine us if we are limiting what we're saying. So the comparison one is recognizing that, you know, if we look around us, are we putting our identity forward as in comparison to others? Because if we are, again, it's going to do nothing for our confidence. There will always be, doesn't really matter who you are, there will be someone who other people feel is better than you. There'll be someone who other people feel has more qualifications than you, or more skills than you, or you know, more mustaches than you, he says, growing in Movember at the moment. So, you know, I think the key here is comparing is the bad place to start when it comes to identity. We are only ourselves, and take out the only. We are ourselves. We've got such a unique contribution to make to the world. And just think about our teams, think about our families, think about the people who rely on us on a day-to-day basis. All of them probably would be very sad if we weren't there tomorrow. So when you're comparing yourself, compare yourself to somebody and then imagine them in your shoes. How might they do things differently? Potentially not very differently at all if they were having to deal with all of the events and activities that are on your plate right now. So comparison is not a great place to start. And of course, all of this leads to an underlying level of stress if we put too much focus on our identity or a specific aspect of our identity, and then anything goes wrong. And let's face it, the last few years, anything could go wrong. It's been an environment in which we've all felt like we're living amongst chaos, a load of uncertainty, and everything, the things that we relied on yesterday are no longer true today. And so be careful how you attach your identity. Go within rather than out. Look at yourself. What are your qualities? Your qualities are much more important than a title. We've all had, I'm going to talk about two bosses now. I bet we've all had one boss who we couldn't wait to move on to the next organization or for them to move on to the next team. And then we've had other bosses like Linda who are just amazing, you know, and I think that's where we come when we start thinking about, you know, the identification piece and where we are with this whole issue of stress. Okay, let's go on to the next slide, please, Laura. So this is your opportunity. Again, if you're in the webinar live with us today, give that a few minutes of thought. And if you're watching this, maybe pause the video and just tap into what's your dream identity. Start thinking about all the different things that you do, all the different things that you're striving for currently. And can you identify someone, you know, the dream you, if you like, a few months down the line, once you've started really truly believing in yourself? What are the qualities that you bring to work every day? What are the qualities that you bring effortlessly into your family situations every single day? Because that's the core identity. So have a think about that for a moment, and then we'll carry on. Okay, for those of you live on the webinar, I want you to just write another thing, another aspect of you that you identify with. So whoever said they're a mum of two, what's the extra part of your identity you're now going to share with us? And Charles, break down I am myself. What do you think is a great quality about what you do? And Jackie, jolly supporter, give us another aspect of your identity that we can all learn from. And for those of you listening to this recording, just keep building that list, because as I said, the more aspects of your identity you can create, the more confident you'll be in your next interactions and the behaviors that will go on to form your outcomes and generate that self-fulfilling prophecy of, yes, this is who I am and this is who I can be and this is how I contribute, all of which is going to reinforce your confidence. Okay, let's go on to the next little activity. So we said we'd have a look at the DNA of a leader, and this is our very complex drawing of a person. It took me 3 hours to do this. I hope you appreciate it. So we're just going to have a think about that leader that you've worked with in the past, maybe, or maybe there's somebody you admire in the public space that is a leader in a way that you really admire. What are the skills, the knowledge and the attributes of a leader? So for the audience here today, think about this in health and care context. So we've all, you know, what aspects of the leaders that you admire would really help us as leaders in health and care? So Laura is going to type down some words that people come up with. So type some words in the chat. What are the skills, the knowledge and the attributes of a leader?
Hey, I've got one here in the Q&A. I've got authenticity, if you're happy for me to start there, Simon.
Sounds like a great one. Sarah's saying calm. Honesty. Openness. How about some of the more practical stuff? What do we need to be good at, if you like? Skills, maybe a bit of knowledge. What aspects of that really help us as a leader?
We've got listening skills in there as well.
Brilliant.
Someone's added.
Yeah.
Compassion.
Fantastic. I think for me, there's, and I know that Linda was talking about it earlier, but it's communication. There's something about that. It's so big as a topic, but if you can get that right as a leader, then people are more likely to follow you. Clarity is another one. And what helps you on a day-to-day basis? What enables you to keep getting up, keep coming to work, keep being that great leader?
I don't know if it's appeared in the Q&A yet, but resilience would probably come from me.
Okay, that's a good one. Oh, I love that from Linda as well. Believing in what we do. So there's that, and it's underlying commitment, isn't it? People can sense it. That will come across definitely in your physiology. Magic. All right. So that's a great list. Thank you, Laura, for capturing those. So the exercise here is, if that is the skills, the knowledge and the attributes of a leader, how are we doing? Are there any on there that you think, I would love to be a little better at that? I'm doing okay, but I'd like to be just a bit better. So which ones are there for you? So I'd like to be more calm. And it's interesting how that one's related to resilience as well, because the more resilient we feel, then the calmer we can be in the moment. And we'll talk more about that later. Okay, so that's the exercise here. If you're watching this a bit later, just have a look at those words and ask yourself, which of those could I be better at? And it's not about saying that you're no good at it currently. It's just a case of saying, I've got more room to grow. And certainly that's the way that a lot of the people that I work with recognize themselves, is they've always got room to grow. There's always opportunities to be even better than we were yesterday. And Charles has said there's struggling with staying calm. Yeah, it can be a real challenge. Great stuff. Okay, so Laura, I think Linda's going to kick us off with the next slide, and then we're going to talk about it between us.
Yeah, that's great. But before we actually move on, I was going to pick up some of the conversation that you were just having, Simon, about people saying, I'm just this, or I am just that. So how many times when you pick up the phone and you've got a friend or somebody in here who goes, oh, it's okay, it's just me. What is happening with their physiology when they say that? They're all kind of, oh, it's just me. They actually, their body curls in, whereas actually if you go, hi, it's Linda, or it's Laura, or it's Jim here, it's a completely different expansive physiology. And again, if we go back to that bird whistle slide, It's about that physiology is the way that we communicate, how we tell people who we are and what we do. So when somebody says to you, oh, I'm just the finance director, or I'm just the practice nurse, or what are they actually saying? Where is their belief in what they do and that the importance of that role within the community? I always find it fascinating how many people use that I am just. So anybody who works with me gets slapped if they say that.
Quite right too.
We go back to the next slide, please, Laura. So the programme that Simon and I have put together is building on the core components of who we are, the leader within us. Because as I said right at the very outset, if it's through from leading yourself to leading a big multi-global organisation, we have to find the leader within. So our programme that we've put together is about building that resilience that some of you have been talking about just now, and how you do that. You know, we admire people who are resilient. Look at Nelson Mandela. He started out basically as a terrorist, but he changed enough within himself by building his resilience to come out of prison at a ripe old age of 80, whatever he was, and actually lead a country through one of its most difficult times. That was true resilience. And I think we've all got components of that within us. So Simon and I, the first programme that we will be running in January is helping you identify and explore your own resilience. Because I tell you what, during my life, if I hadn't been able to build that resilience, I wouldn't have had as much fun. I wouldn't have been able to support other people in the way that I've been able to, or make my contribution to health and well-being. So resilience for me is a really important foundation in becoming a leader. Simon, do you have anything to add to that?
Yeah, I think the focus there in that program, Linda, as you know, will be very much on practical stuff, things that I can do differently straight away, because resilience is actually something that if we're not working on it all the time, then we're actually undermining our resilience all the time. So it's a very binary thing. Unless we're constantly conscious of our resilience and what we're doing to build ourselves up, we're slowly undermining it. And so there'll be a ton of things in that workshop that you can literally pick up and implement straight away. And that's very much a core component, if you like, of this whole program. It's very practical. Linda and I were joking as we were putting these things together about just how practical we are as individuals. We both got great ideas and lots of visions about how great things can be and how we have so much belief in people. But when it comes to how can we support and help people, we both genuinely believe it needs to be practical. It needs to be something that people can go away with and do something with, so that their lives are fundamentally changed straight away. So that resilience module there will definitely reinforce that for you.
Yeah, and likewise building effectiveness. It's about how can we work smarter? How can we develop the more effective side of ourselves simply and practically? As Simon said, every single component of this course is around what are the practical tools I can carry around with me every day in my toolbox that I can use to build my resilience and my effectiveness, and the dialogue that we will come on to. So effectiveness isn't all about writing lists. It isn't all about having the right answers. It's about being a human being and developing strategies to build our own effectiveness in a way that works for us. I mean, someone who came into my office right now would wonder what the heck was going on, because I've got piles of things in various different places, but I know how they relate to each other. And if I was contained in a very tiny space, my effectiveness would diminish, because I need to have things placed out so that I can find what I need and thread the pieces together. So it'll be about you developing your own approaches to building your own style of effectiveness, whatever that might be.
Yeah, and I've recently written a book on this specific topic, and the subtitle talks about all the tactics and tools and strategies and skills and all the rest of it. But the last few words are really important. It's all about balancing your life your way. And as Linda was suggesting there in terms of the design of her desk, it's the same with our lives. We don't have to be like anybody else. It's back to that identity point again. We can all find ways of doing things that is effective for us. And that's the key. So we'll share some ideas and some insights and maybe even a little bit of inspiration when it comes to becoming more effective. But I think the core of it will be, who are you and how do you like to do things? And then can we refine that in a way that enables you to be even more effective? So again, lots of practical stuff, lots of great ideas, but at the core of it, we will be exploring with you just what is your why. So those of you who are fans of Simon Sinek, and he says, start with why, the same is true for us as individuals. What's your why? What is it that you want to achieve with your life? Let's start as big as we possibly can and then break it down and say, okay, so what does that mean for my goals and for the things that I want to achieve this year? What does that mean for the way I go about my job and the way I interact with others? So there'll be qualities in there, there'll be aspects of your work in there, but it all comes together in a nice, neat little package that enables you again to go away and start doing things very differently.
Yes, and the final component is building dialogue with ourselves. Now, lots of people say, I don't actually talk to myself. I haven't come across anyone that is absolutely true for. Think about what I said earlier. We have at least 60,000 thoughts a day or 65,000 thoughts a day, most of whom, which are the same as yesterday. Deepak Chopra has done a lot of research into that, and the dialogue that we have with ourselves, we can change that. Sometimes we only need to change one word, and it shifts our whole physiology and our whole thinking. So this section will be about how we build effective dialogue with ourselves, to build our confidence, to know that if we make a mistake, that's fine. We just learn from it, we move on. If we don't make mistakes, we don't learn. But it's about that dialogue you then have with yourself after the event. And that internal dialogue is it's one of the most powerful things that we can develop. And nobody needs to know what you're saying to yourself. You can keep it as a big secret, because the fact that it's going on inside of our head, nobody can tell that it's there. So we can change it as much as we like. We can create that dialogue so that it becomes more supportive of us and the things that we do.
I'm quite glad that people can't hear what's going on inside my head most of the time. No, you're absolutely right, Linda, because it all comes back to the points that you were making earlier around, that little, I think you call it the helix diagram of where our results come from. Our results actually go right back to what are the thoughts, what are the words that we're saying to ourselves in our heads. Are we just something? Are we only something? Or are we specifically this, and I'm going to make a difference? And the radical shift that those two things can make in terms of your outcomes is amazing. But this is about building that dialogue with yourself such that you can make an even bigger impact. And as a leader, that's what we're all here to do. We're here to make an impact, but we're also here to contribute. So who's the better contributor? Is it someone who's underconfident and feeling like, they're not as resilient as they could be, they're not as effective as they could be? Are they as good a contributor, if you like, as the person who actually has those things sorted out? Now, obviously, it's a leading question, but the point of it is that it's just showing you, if you like, how all of these things are connected, and it's all about who you are. It's going within. And that's what Linda and I will help you do with this program, is go within and extract that person who's going to be an amazing leader. And that amazing leader is you. It's just that you maybe haven't chipped away at the block enough yet to really discover who that person is. So that's what this program is going to help you do.
And let's face it, you're all great leaders already. You just haven't connected with that.
Yeah, absolutely. So it's all about your personal leadership approach. You will come away from this program feeling like, yes, this is me. This is how I like to do things. I'm not copying anybody else. I'm not comparing myself to anybody else. This is my form of leadership, and this is how I want to do it.
Laura.
Brilliant. Thank you very much, Simon and Linda. I'm a little bit lost for words because I was taking lots of things in there, and every time I wrote down a question, you answered it. So thank you very much. So I'm going to move on just to make our audience aware of some offers that we have got going on this week as part of our launch week. And from today up until Sunday, the 21st of November, we're offering 15% off the prices of our academy courses. That includes the new Finding the Leader Within programme. I'm really pleased to let you know that the first cohort of the Finding the Leader Within programme will start at the end of January, as I think Linda mentioned. And if you do want to sign up for that, you can use the Academy 15 code for 15% off the price. In addition to that, for anybody who signs up to the programme this week, we're also offering a free coaching session with Linda or Simon. And I don't know if either of you wanted to add a little bit more detail around that.
Yes, very, very happy to. Our style of education facilitation training is all about coaching. So the programme will be a coaching experience anyway. However, we thought it would be really useful for people to have an individual coaching session, given where the health service is at the moment, some specific time for you as a person to explore some of the things that are really important to you. We thought it was something we would like to add to this course to help you navigate through the next few months. So it was something, we had a chat about it yesterday and we thought, yeah, that's a good thing to do. So let's do it.
Perfect.
Brilliant. Thank you, Linda. Sorry, Simon, did you want to add anything there?
No, I was just saying that was perfectly expressed. Thank you, Linda.
Fantastic. Right, unless there are any questions, but I have been keeping an eye on the Q&A and I don't think there's anything outstanding, but we have got a couple of minutes if anybody wants to pop any last minute questions in there. Sarah, has anything come through to you in terms of socials, or have we covered it all?
We've covered it all from the social aspect as well, thank you.
Fantastic, that's always good to hear. I have just popped a link into the Q&A, as I say, to a very brief evaluation form, and it's also an opportunity to share your details with us if you would like any more information about any of our courses, our training or our events. I think that's everything, unless Linda or Simon, there's anything you'd like to add before we finish up.
Just to say thank you to everybody for coming along, and we look forward to continuing the dialogue and finding the leader within.
Definitely. And I just wanted to thank Laura and Sarah and the team as well for all the work they've done in the background to make this possible. So it's been a great experience. And I look forward to working with any of you that are listening right now that want to come along and join us in the new year.
Fantastic. And thank you, Linda and Simon. It's like the Oscars, isn't it? Thank you for everyone who's been involved. And thank you to everyone who's been listening today. There are further webinars for the rest of this week. We've got an introduction to NIV this evening, and then we've got sessions later in the week with Paul Vaughan from NHS England and our very own Assistant Director of Clinical Learning, Preeti, who will be talking about person-centred care. So hopefully we will see some of you then. Thank you very much. I'm going to end there and turn off the recording. This will be available for you to have a look at later on. Thank you very much.
Thank you.
Thank you.